To reduce the spread of COVID-19 and its impacts on health and society, a safe, effective vaccine is the most important intervention to end the pandemic. Coming up on Polk Place, we'll talk with the Florida Department of Health in Polk County about COVID-19 vaccine programs. Make sure you stick around. Welcome to Polk Place. I'm Brian Lacey, and joining me in studio is Tammy Durden. She's the Director of Nursing and Community Health Services for the Florida Department of Health in Polk County. Welcome back to the show.
Thank you. Good morning.
It's been a while since you've been here, but going to give us a little bit of a COVID update. One thing I want to talk about is something that we hear in the news a lot, the term population immunity. What exactly is that? What does it mean?
Yes, population immunity. All that means is how many people in a community are protected against the virus, meaning they've either had the virus or the disease or they've been vaccinated for it. And this is very important because the more people that have immunity, the harder it is for the virus to spread from person to person. So we want big immunity.
One of the things that we're hearing is an age limit. What is it that we're looking for that we can, what is the youngest age to be vaccinated?
Okay, in the United States we offer 3 different vaccines, and one of them is Pfizer. And Pfizer is for our youngest, which is 12 years of age right now. So Pfizer, 12 years of age and up. That is a 2-dose series given every 21 days apart. Then we have Moderna, which is for 18 years of age and above, and that's also a 2-shot series given 28 days apart. And then we have Johnson & Johnson. That's also for 18 years of age and above, and that's the 1-shot.
Want to talk vaccine myths, if you could,
Sure.
trying to quell the rumors. Talk to me a little bit about that.
Okay, I mean, there are so many rumors. I mean, you hear so many crazy things. First, we would like people to know that there is no evidence that it is harmful for pregnant women. Okay, so if you are pregnant, you are thinking about becoming pregnant, you may get the vaccine, the COVID-19 vaccine, any of them that we offer in the U.S. When they become available to you. There is also no evidence that it causes harm to the pregnancy or to the development of the placenta. In addition, there is no problems for the female or male fertility problems. Some people thought they maybe could cause side effects, and there is just no evidence of that. Any kind of side effects for any vaccine, actually, and also including the COVID-19 vaccine.
One of the words that I've heard recently, magnetic.
Oh, I know. No. There is no ingredients in the vaccine that is capable of producing any kind of an electromagnetic field. So no, there is no metal in the vaccine. There's no nickel. There's no iron, and there's also no manufactured, materials that are also in there that can be considered a mini electronic.
What about alteration of DNA?
No, it does not impact the DNA, change the DNA in any way.
One thing that we are hearing, depending upon the shot that you get, side effects of getting the shot, can it make you sick?
No, it does not cause COVID-19. So no, it does not cause the virus. Because in the United States, we do not use a live weakened virus. So it does not cause, it is not capable of spreading to anybody. But you can get just common symptoms from that vaccine, like any kind of vaccine. But does it cause COVID? No. Can you maybe feel a little wimpy, for a day or so, maybe some body aches or something like that? Some people do, a lot of people don't. I was vaccinated, I had no symptoms. Most of the people I know didn't get symptoms, but there were some that said they felt a little wimpy for a day.
What about getting the vaccine? Can it cause a positive test? Is that a possibility?
No, I think where people get confused, the vaccine will not cause you to test positive. That's just not possible. But where I think people get confused is if you've had the disease or you've had a vaccine and then you take an antibody test, an antibody test can detect whether or not you were positive previously or you had a vaccine. And that just shows you have antibodies to the vaccine, which is what we want. We want people to make that immune response. So an antibody test will test to see if you have an immune response to the vaccine or to the disease itself, which is a good thing, because that means that you're protected or you have some form of protection. Otherwise, it does not cause you to be, to test positive.
One of the things that I want to talk about is, as we had talked about, trying to get everybody vaccinated.
Yes.
What's the easiest way for folks to get vaccinated within Polk County? We have a lot of great community partners working with us. Talk to me about the easiest way to do that, or possibly going through you guys, and you guys have a website that we can do that?
Yes, we have our website that you can go to, which I think you'll probably post at the end of the show. It is very easy. So many people are offering the vaccine now, so there's really, you can find a place in your communities. Walgreens, CVS, Publix, Walmart, there's private pharmacies, they all offer the vaccine. We also offer it at our health department. On Mondays, we're at our Lakeland DOH location. On Wednesdays, we're at our Vaccination Center in Auburndale. Thursday, we're at our Bartow location every Thursday, and on Friday, we're in Haines City. So we try to spread out through the, all throughout the, the community as best we can. Plus, we're always going on outreaches. We go to different churches all the time, different, community events. So we try to make it accessible to everyone as best we can. And we're also open at our DOH locations from 11 a.m. to 6 p.m. So in case you have a problem, getting a vaccine after work. And if somebody calls us and says, I need it earlier in the day or a little bit later, just call us. We'll try to make that happen too.
We've got just a few minutes left with the time that we have remaining. I'd like you to influence those that haven't got the shot yet, or those that, as we just have stated, may have only got their first shot and haven't got the second. Talk about the importance and what the difference it's going to make in this community, if you would, please.
We talk to everybody every day at a lot of our events. We try to, answer people's questions. I respect people who are hesitant, or if they just have questions, I want them to go to a reputable site. Please don't get your information from the internet or from YouTube. People tell me, I go to YouTube. Don't do that. Go to a reputable site. This is the best way that you can protect you, yourself, your family, and the community, is to get that vaccine. Okay? And if you're unvaccinated, you really need to still wear your mask. Everybody needs to be washing their hands, covering their coughs, their sneezes, washing, down frequently touched items, and monitor yourself. But the best thing you can do for yourself and your family, just look around. I'm sure everybody's been touched by it. Get that vaccine. It's the best thing you can do. It's the only thing really we can do.
Well, Tammy, thank you for coming in today and sharing the information. And come back and see me again soon, will you please?
I will. Thank you.
COVID-19 is still a concern for everyone, and proper measures should be taken. We've not reached population immunity. Now, population immunity is when enough people in the community are protected from getting a disease because they've already had the disease or because they have been vaccinated. This makes it difficult for the disease to spread from person to person. COVID-19 vaccines are widely available and free of cost. You can also seek vaccinations at CVS Pharmacies, Publix, Walgreens, or Walmart facilities. You can also get them at Florida Department of Health facilities. On Mondays, they're at the Lakeland DOH Clinic. On Wednesdays, the Auburndale Testing and Vaccination Center. On Thursdays, the Specialty Clinic at 1255 Bryce Boulevard in Bartow. And on Fridays at the Haines City DOH Clinic. If you need more information, you can give them a call at 863-519-7910 or look them up on the web at polk.floridahealth.gov.